Having chronic dry eyes can be debilitating, but fortunately, there are simple remedies for dry eyes. We spoke with Dr. Wallace Goldban of the Desert Regional Medical Center in Palm Springs to learn about this condition and the recommended treatments to relieve the discomfort.
Dry eye is a problem that is plaguing the nation, and it's also received a lot of new and revived interest these last few years because it is so prevalent and so annoying. It's basically a syndrome where we don't make enough tears. And our eyes always need to be moist in order to function efficiently and to be comfortable. The tears are always coating our eye and washing away bad bacteria, dust, pollen, whatever gets in our eyes, the tears wash them away. So if we don't have enough, your eyes are going to be in danger of problems. The most common symptoms of dry eyes are burning and tearing, and which is the most confusing thing for most people because people think that their eyes are always tearing, that they're not dry. But believe it or not, tearing is one of the biggest symptoms of dry eyes, and what it means is that the eye is irritated. So the eye is sensing the dryness, and the tears are trying to make up for it, but those are reflex tears. And reflex tears are never as good as the basic tears that should be coating your eye. So those reflex tears will be tearing all the time, making it feel like your eyes are watery, but the reason is because they're dry.
Dr. Goldban told us about the causes of dry eyes.
The incidence of dry eye is about 15% in people 50 and over, and it's usually women. And a lot of that has to do with the hormonal changes as we hit menopause. But as we get older, the incidence increases because that's due to medications that we might be taking, like diuretics, allergy medications, pain pills, and even allergy medicines. So a lot of times people will take allergy medicines because their eyes are watery, but that's actually drying them out more.
Dr. Goldban explains the treatment options once a patient is diagnosed with dry eye.
A couple of different treatment options that are available. The first one that I like is punctal plugs. All the tears that we make, they go from your eye into the nose. That's why when we cry, we have to blow our nose, because that's where the tears go. But imagine if your eyes are dry, you don't want to be losing any tears in your nose. You want all the tears you make, even if there's not a lot of them, to stay in your eye. There's a pathway between the eye and the nose in the eyelid. And what we can do is plug that up with a very easy office procedure where a little plug that comes in all different sizes that can be customized to your eye will actually block that drain and keep whatever tears you do make in your eyes longer. And the reason I like that is because if it works, you're done. And you don't have to take any more medicine or drops. The next thing is Restasis. And this is actually a medicine which will help you make more tears. It will turn those glands back on that aren't making enough tears for you. The only problem with Restasis is that it takes 3 to 6 months to start working. Some of the things also, by the way, that you can try at home that I haven't mentioned, which is very important, is to try to get a humidifier at your home. When you sleep, being here in the desert especially, it's so dry that pumping in that extra humidity will really make a difference. And there are also vitamin supplements, alpha omegas, and things like that really do help. All the fish oils have been shown to make an impact on how much tears you make yourself.